Welcome back to the Nutrition Made Simple podcast, powered by Healthy Steps Nutrition. At HSN, our mission is to help 1 million people take control of their health one step at a time so they can prevent and reverse chronic disease. We know that helping people become the best and healthiest version of themselves isn't just about what they eat or going to the gym a few hours a week. We have to focus on a holistic approach, addressing nutrition, stress management, mindset, sleep, support system, lifestyle, because all of these factors are going to influence nutrition decisions and your overall health. My name is Nicole Coyne, and I'm the founder of Healthy Steps Nutrition, home of CrossFit HSN and HSN Mentoring. In this podcast, we're going to teach you how to take one step at a time to take control of your health. I'm super excited about today's podcast guest. Meg is a nutrition coach at Ironclad CrossFit. She's also a nurse with over a decade of experience. She actually decided to come on board and work with our dietitians at Healthy Steps Nutrition HQ for a continuous glucose monitoring experiment. Typically, continuous glucose monitors are just for diabetics. And in this case, we have a partnership with a company where we can have clients do continuous glucose monitoring that aren't for diabetics. So anyone can get this information, learn a little bit more about what's going on inside of their body. And Meg did this. She had some incredible eye-opening results. And I thought it was super interesting, with all of her experience doing nursing and working in the medical field, she decided to take this experiment on herself. And I'll let her share the results with you, but they're absolutely incredible. And she even shares the feedback that she received from her endocrinologist as well, which is awesome. We will get to this podcast right after this message. If you are interested in learning more about what's going on inside of your body and you are interested in the 6-week continuous glucose monitoring experiment, we would love to help you at HSN HQ. You can click the link in the show notes and you can book a discovery call to learn more about this program. Basically, what's going to happen is you're going to be paired with a dietitian. You will get a 30-day supply of the continuous glucose monitoring system that goes into your arm. Promise you can't feel it. I did it. And I hate needles. It was super easy and simple to do yourself. And then you're going to have calls with one of our dietitians every single week to review what's going on the inside of your body and help you make small tweaks so that those can make big differences over time. If our mission is to help people prevent and reverse chronic disease, understanding what's going on inside of your body when you eat specific foods so that you can manage your blood sugar is huge. Did you know that when you look at the top 10 causes of death in the United States, 9 out of the top 10 are caused or worsened by elevated blood sugar? This is key to helping you prevent and reverse chronic disease. Super excited about sharing Meg's story today. And again, if you are interested in doing this yourself, you can click the link in the show notes and you can book a discovery call with us at HSN HQ today. Meg, thank you so much for coming on the Nutrition Made Simple podcast. I'm so excited to have this conversation today.
Great to be here. Thanks for having me.
So let's just introduce the viewers. You have a long-standing career as a healthcare professional turned nutrition coach. You actually came on board as a client with our CGM program, our continuous glucose monitoring program. So lots to unpack today, but let's start with you personally first. Tell me a little bit about your professional background.
So I've been a nurse for 40 years, which relegates me to dinosaur status. I've done many different things. Neonatal intensive care for the first part of my career, surgery world, second part of my career, pre-surgery prep, and I was a transplant coordinator for kidney pancreas service for a while. So after 39 years in hospital, I made the transition. I currently work in an internal medicine practice as an office nurse.
You were in sick care, like you were really in sick care, especially doing kidney transplants. Let's talk a little bit about this because a lot of people don't realize where kidney disease comes from. Like, how do people get kidney disease? What did those people that you worked with, what did they struggle with, specifically the kidney disease patients?
So the top 2 reasons why people end up with chronic kidney disease and possibly dialysis and in need of transplant: diabetes and high blood pressure, and in many cases, preventable things.
Right. Yeah. I mean, it's so interesting when you look at diabetic patients, a lot of them don't realize or they don't take it seriously, the importance of controlling their blood sugar, and then their A1C is going up. And then, you start getting the tingling in your hands and then your eyesight, and then your kidneys, start not functioning properly. Then we're on a different diet because our kidneys aren't functioning properly. And then we're needing dialysis and then potentially a transplant. It's you're right. It's a lot of it is preventable if we're able to control our blood sugar. Let's talk about your transition this past year. So you were on the pretty sick side, working in the hospital. Now you're not really on that side as much, but there's still not a ton of time to talk to patients and give them the support they need with lifestyle interventions, even in primary care practices.
Exactly, exactly. The time, you're running rooms, you're drawing labs, you're doing injections here and there. You try to add snippets of information when you can, but the time goes to the sickest of the sick, right? Providers are all seeing too many patients, a couple minutes per. People that need lifestyle modifications might get, a pat on the back as you walk out the door. You need to lose weight, move more, eat less. But we don't really have the time to provide education and resources in many cases.
Even in the hospital setting, when I was a dietitian at the hospital, there's not enough time there. I was like giving people a sheet. Here's how you manage your kidney disease. Here's how you manage your diabetes. Type 1 diabetics, the kids, we would spend a lot more time with. But other than that, like the system is not set up. When you look at the average doctor's office having, 2,000 people that they're seeing a year, 12 to 17 minutes that you're spending with a patient, it's just people cannot make lifestyle changes and have that support that they need to make the behavior change in that traditional model, which is why it's really cool that you've taken all of this medical knowledge that you have and you're now doing nutrition coaching at a gym, which we'll talk about in a little bit. I want to talk about your personal journey though. Like clearly you have an extensive knowledge on health and biomarkers and what they should be. But talk to me a little bit about your journey with health.
So my journey with health, I was that person that had a physical every year and they would say, see you next year, never had an issue until this past year and a half. So started with a new primary care, did a panel labs, everything came back wonky. I have a new diagnosis with an autoimmune disorder. And then on top of everything else, I'm concerned and kind of push the envelope. And looking back, my fasting sugars have been high for 6 years. And I had to really bully my provider into checking an A1C. And we checked and then we monitored, and my A1C was going up, despite, doing all the things, right? Healthy weight, exercise, clean eating, but my numbers are going in the wrong direction. So.
And I think that's the majority of people in the US, right? Like we do blood work, and then unless our numbers are really off, we're not told anything other than keep doing what you're doing because it's still in the normal range, or it's creeping up, but it's not at the point that we need medication yet. So
Correct.
we're just watching it, which is what I hear so often. And that's the time when it's so important to make the lifestyle interventions to take control of your health so you don't get to a point of like, oh, I have diabetes now, and now I need X, Y, and Z medication that probably could have been prevented from changing the habits and lifestyle interventions years before. So let's talk about this. You didn't realize that your fasting blood sugar was high for a few years, or maybe not super high, but trending up for the past few years. You realized that. Then what'd you do?
So you realize that, but nobody's really paying attention, and it's easy to write off. The doctor's not worried. I'm busy. I'm not going to sweat that. But then it gets to a point where everything else is abnormal. A1C, again, the A1C doesn't lie. For anyone that does not understand, it's the hemoglobin A1C, and that is reflective of what your blood sugar averages over the previous 3 months. So that one doesn't lie. You can't blame that on something you ate the night before. So
Right. So some people get that checked. Hopefully your annual blood work is getting that checked. But if it's not, then you should ask for it so that you can see. Because there are some factors that will influence fasting blood sugar. For instance, if you have alcohol the night before, or if you are exercising before a workout, or if you're not sleeping adequately, your fasting blood sugar is going to go up, which could, you know, tell you a different story than what's actually going on the past 3 months. So getting a full picture, you get the A1C, you're like, okay, my endocrinologist is saying, let's just watch it, or let's just keep monitoring. But you're like, no, 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 I need to take control of my health. And
They didn't even want to check it because I have a BMI of 21. I eat clean and I exercise. So he didn't even believe, once we checked it and it was high, didn't even believe it. But that is what prompted me to do the CGM coaching.
mm-hmm, mm-hmm. And that actually is becoming more and more common. Like if you look at the people with prediabetes, 80% of people don't even know that they have
Correct.
prediabetes. So, gosh, if we think thousands of people listening to this podcast, 80% of them do not realize, man, my blood sugar is actually trending in the wrong direction every single year. And now is the time for me to realize what I can do to get my blood sugar back in check so that I am preventing and potentially reversing type 2 diabetes. So CGM, before we started recording, I was like, I wish I would have done the CGM when I was working in the hospital. I would have had such a better understanding of a lot of different things when it comes to managing your blood sugar, because what you read in a textbook and what we're required to say working in a hospital,
Right.
even the American Diabetes Association is funded majorly by the food and beverages companies, right? So like it, what you are what the general recommendations are skewed because of who's influencing the research and who's funding these nonprofits, which and podcast for another day.
Another podcast.
But the point is if healthcare professionals actually did this, if everyone actually did this for a month and realized what is going on the inside of your body, you would start making changes that would help you prevent disease. And I think your story is a really great testament to that. So you decided to do the CGM, which normally for people that are listening to this, a continuous glucose monitor was originally designed for type 1 diabetics. Type 2 diabetics are now using it now, where it puts a tiny, tiny little needle in your arm and constantly is checking your blood sugar instead of the pricks, which are kind of painful in my opinion and super uncomfortable, and you have to do it every time. But the benefit of a CGM is that you can constantly see what's going on in the inside of your body as you eat, as you sleep, as you exercise, after you walk, all of these things, and track what is going on in my blood sugar to ensure that it is, the majority in range to help your fasting blood sugar stay under control and then also get your A1C under control. So you decided to do the continuous glucose monitor. Talk to me a little bit about that process. What was it like? What did you think it was going to be like?
I was actually shocked at the results. Shocked because, again, such a clean eater. So what I thought were healthy meals, they were healthy meals, but my results were pretty amazing. So the way it works, it was a 30-day program, 30 days of the monitoring. It was a 6-week I did. The first week we focused on, my coach said, just eat how you normally eat. I don't want you to make any changes because we want to get a good baseline of what your normal diet. Mm-hmm. So for me, I meal prep. I'll give you an example of a lunch: 4 to 6 ounces of grilled chicken, broccoli, roasted broccoli, big old plate of that. And then a measured half a cup of a complex carb, such as millet, quinoa, sweet potatoes, and then fruit for dessert. So pretty healthy, right?
Yeah.
So that meal, I was shocked. I think I had that meal my second day. I spiked to like 240 or 250. I was
wow.
like, what the heck? Like, I'm doomed. I'm doomed. Friday night is our carry-out sushi night. We don't eat out, prepare most meals at home, but Friday night, it's the end of the week. We take a break and carry out.
Yeah.
So two sushi rolls, and then that cottage cheese ice cream that went viral on social media. That was my big cheat dessert. I would, eat dinner and then have that as a late night treat. That spiked me ridiculous high, and I sat high. I was elevated all night. So it was very evident what I thought was a very clean diet was not great for me.
I think that's an important distinction. Like all of those foods, technically healthy options, but maybe in the portion sizes or the way your body breaks food down, it isn't the
Mhm.
best option for you to prevent, chronic disease. So you realize these things are getting high, and sushi is actually a common one where people don't realize how high their blood sugar spikes after eating sushi rolls. But tell me, what were some of the changes that came out of the experiment for you?
So it was amazing the simplest things that impacted. So take that lunch that we went back to,
Yeah.
take the fruit out.
Mm-hmm.
So fruit, pair that with some protein pre-workout. And that is my perfect pre-workout because I'm going to be using those muscles, increase glucose uptake. So switch
Mm-hmm.
that out. The most surprising thing was the order in which you eat your food. So you have to have a balanced meal, and that was something I needed to work on, making sure carbohydrate, protein, fat with every meal and snack. However,
Mm-hmm.
the order matters. If you eat your protein and your veggie first, leave the carb till last, did not spike as high and came right back down.
Yeah,
Amazing.
isn't that interesting? And it also, for most people, when they have a more balanced meal, like the portions that you are talking about, they are probably eating less carbohydrates than they normally consume. So from a mind perspective, if you're filling up your stomach with vegetables and protein first, and then you have this starch, you're probably more satisfied with a little bit smaller amount. And as a health benefit, it's not going to spike up your blood sugar as high.
Correct. Correct. Adding fiber, increasing fiber.
Mhm.
My coach had suggested, don't forget about beans. Beans are high in carb, but they're also high in fiber.
Mhm.
So didn't spike as high with that. And
Yeah.
movement, of course, movement, not being sedentary after a meal. That was the big thing because Friday night, you're tired. You eat, you
Mhm.
crash in front of the TV, not good. And then to have that late night snack late, that was the kiss of death for me. So
Yeah, I think most people are very surprised at how much their blood sugar will actually go back into range if they just go for a 15-minute walk after meals. Like
10, 15 minute walk.
so simple, so effective. To get outside, and it's good for your body, for your health, for your immune health, for your mental health, to get some sunlight too. So many benefits for that, for your energy levels as well during the day. All
For
right,
sure.
so you did the CGM, you started making these changes. What ended up happening by the end of the program for you?
So by the end of the program, my numbers were back in range. I was 85 to 95% in range. My variability was greatly decreased because you don't want your variability high. You want that on the lower side. And I am anxiously awaiting. I don't do my A1C again till January, but based on what my numbers were running, I will be in the mid fives probably, I
That's
anticipate.
Oh, that's awesome. So you did the CGM experiment. You go back to your endocrinologist. How was that
Mhm.
conversation?
So he was pretty impressed. And he said it was interesting. I fall into that subset of just impaired glucose metabolism. So a normal person could eat half a watermelon and probably not spike greater than 180, is what he told me. But, me, I'm up in the ozone, 250 or above. But he said, had I continued eating this way, he feels certain I would have eventually become diabetic. However, with making these changes now early, we are hopeful that we have won that battle and I will not progress or need medicine. So that was the whole goal.
That's amazing. I mean, good for you because ultimately, like, you worked in the hospital. You understand. You worked with a lot of diabetic patients, like waiting until it gets to a point where you need medication and those medications have side effects and all of the rabbit hole that you go down when you
Absolutely.
get into the pharmaceutical hamster wheel, as we call it, that now you don't have to be in right now because you have figured out a way to take control of your health through diet and exercise. And I think the interesting point of this conversation is that you weren't eating healthy, like unhealthy before. You were eating healthy foods before. You are a healthy weight. And I think when people think of like a CGM or working with a nutrition coach, it's, oh, I have to lose weight to be able to do that. And that's not the case. It's like, I want to get to know my body better. I want to know the habits that I need to get into place now so that I can prevent myself from getting sick and fighting chronic disease down the road, because the habits that we have today are going to impact us 5, 10 years from now.
Absolutely. And I'm so about prevention. And I have become increasingly frustrated over the years because guess what? Patients are getting sicker and they're being diagnosed with all these things at a younger age. So
Yeah. I mean,
we
you
need
look
to
at just
change things.
the general population, 60% of them have at least one chronic disease, 40% have two or more. And as we get older, that number exponentially goes up. So the system, something is wrong. The way we're doing healthcare right now is not working. We have to
It
admit
is
that.
broken.
And health isn't found in a doctor's office. It's created inside of a gym, working with a coach to understand your body, which is actually what I want to shift gears to. So you were working in the hospital for a really long time. Now you're not, but you also do nutrition coaching at a gym. Tell me a little bit about that experience going from sick care, I would say, to more health care and prevention.
Well, I did it because that allows me to have time to do the things that we need to do, right? Educate, provide resources. So it was a great switch for me. When Danielle approached me, I guess I had been a member at the gym for about a year, and I was a little hesitant because I really didn't have my own stuff figured out yet. But I had just come out of a 12-week course on functional medicine for nurses. And when I looked at your program, it was really the same basic things that we reviewed in functional medicine. It's all about root cause. And
Yeah.
interestingly, in functional medicine, if anyone follows Mark Hyman, he's the man.
Yep.
Um, but if you go to a functional medicine provider, regardless of what's wrong with you, the first thing they're always going to look at is gut health and nutrition. So it just made perfect sense for me. So that's why I chose to do the certification and start coaching.
Amazing. Tell me a little bit about the role that you have with Ironclad and what you are doing to serve the members and even non-members, just people in the community looking for nutrition coaching there.
So my big platform, and I just actually did my first nutrition talk a couple weeks ago. My topic was ditch the diet, how to make lifestyle changes that last.
Cool.
And that is the message I want to get across to people, that it is not about a smaller pair of pants or a number on the scale. It is about taking a proactive role in your own healthcare and preventing all these things later on. We
I
want to
love that.
thrive in our older years, not just survive.
Yes, absolutely. So you did a nutrition talk and you also work with people one-on-one. So what does that look like for you?
So we have the individual coaching, the one-on-one, and we also just launched, we do the 28-day wellness challenge twice a
Mm-hmm.
year. So we just
Yep.
kicked off that, our second one for the
Awesome.
year. So those folks, that's more a group setting where we have common goals, group chat, that sort of thing. But the individual clients, it's more geared to what do you need to work on? Let's talk about your long-term goals. Let's talk about your why first and
Yeah.
foremost, because we know that clients that understand the emotional reason behind their why do you want to achieve this goal, are generally more successful. So we
Mm-hmm.
spend a lot of time delving into that and then setting that long-term goal and then looking at the short-term goals that are more the motivation to keep you going. And there's support and accountability every day through the app. You have access to your coach 24/7,
Yes,
something like that.
you have someone in your back pocket to help support you and you're working with clients
Correct.
to not just giving them a plan, but really locking arms with them to help support them every step of the way, which in their traditional office setting, going to your doctor's office, you're just not able to get that, right? Like you get an
Correct.
assessment, but then this is really helping you create the foundation of healthy habits so that that assessment every year, that report card for your health is improving instead of, going and trending in the wrong direction. You guys are doing an amazing job at the gym to serve your community. What would you say your favorite part of nutrition coaching is now that you have become a nutrition coach? versus maybe some of the stuff you were doing with nursing?
I would say just sharing some of the non-scale victories. When someone tells me, yeah, I went out to dinner and for the first time, I wasn't tempted by the bread basket because I thought about, yeah, that really doesn't serve my long-term goal. Or they looked ahead at the menu and kind of had a plan what they were going to order. Or they went on vacation and for the first time made it a point to do some kind of activity every day. So it's just sharing in those big lifestyle changes that are sustainable.
That ultimately leads to the results that like you had, right? Where our blood markers are trending in the right direction instead of the wrong direction. Or, I no longer have to ask for the seatbelt extender when I am going on a plane and those sorts of things. Like, yes, it's great. And a lot of people have weight loss goals. That's fine. But we want to look at those non-scale victories too, the confidence that you have where you're not feeling restricted, but actually empowered to make healthy choices for a lifetime, not just for, a certain restrictive timeline. So I'm super excited about everything that you guys are doing. Any final thoughts as we close today that you want to share with anyone?
So I would say if you are on the fence about nutrition coaching, cost is always a barrier for some, or in your mind it is. But I would say money well spent. And I always tell people, you can pay for it now, you can pay for it later, but diabetic supplies are really pricey too. So,
Yeah, absolutely. Thank you for all that you do to empower health and serving the community. I know you are a staple in the community up there. If anyone has well, let's just talk about this. Where can people find you? Where is the gym actually located?
so it's Ironclad CrossFit in Easton, Maryland. And I'm
And
assuming you'll post
yeah,
that information.
I'll put it in the show notes for sure. And then I'll also
Perfect.
put your personal social media in there so people can follow you. You work
Perfect.
with people all in Maryland, so they don't just have to be super close to the gym. They don't have to be members of the gym to
Correct.
work with you and you to help them on their nutrition and health journey. Meg, thank you for doing the continuous glucose monitoring experiment, that program with us. I think it's really impactful to understand what's going on in the inside of your body. And the truth is, we look at a number on the scale and we see those numbers trending, over time, but there's not really many tools that give you real-time data of what's going on inside of your body, like the continuous glucose monitor does, where you can get a real good insight on the foods that you should eat and things that you should do, how to pair meals, the order in which that you eat a meal, and start making educated decisions to help you ultimately prevent and reverse chronic disease. So thank you for trusting us to
And
help you on that journey.
here's a question.
Yeah.
Why does insurance not cover these monitors? Every pre-diabetic should have this opportunity.
Yeah, it's unfortunate, but luckily with us, with the partnership that we have that allows us to do this and allows our dietitian practitioners to be able to see all of the clients that are enrolled in this program in real time, is that they aren't diabetic. So that's actually unfortunately, the people that need this type of coaching the most are the ones that have diabetes, and they might have a continuous glucose monitor, which is great, but they don't have a dietitian helping them connect the dots with
Correct.
why the things are going on and help you make educated decisions. I remember talking to my uncle a few years ago, and he had uncontrolled diabetes for years. And I was like, why don't you have a continuous glucose monitor? Like, it will be covered by your insurance. And his doctor just never recommended it for him. And then the next month, he went to the doctor's office, got it, and fast forward 2 years, his blood sugar is actually under control now, because he has that real-time data, which is really amazing. And I think it's even more powerful for people looking to prevent chronic disease to get it now, to see what's going on the inside of your body, because every person's a little bit different, like what you have that really spikes up your blood sugar could spike up mine the same, or it could not. Everyone's body's a little bit different.
Everyone's different. But I guess the
Yeah.
take home message is ask questions and don't take no for an answer.
Right. And sometimes you have to invest in your health. And that investment looks like hey, I'm going to get a continuous glucose monitor so that I can see and prevent myself going down a path that the traditional healthcare system will put you on if you don't figure out how to manage your blood sugar by yourself.
Correct.
Awesome. Well, Meg, thank you so much for coming on the podcast. And I'm excited to send more people to you guys at Ironclad and for you to be able to continue to serve your community and empower health. So thanks for all that you do.
Thank you so much.
I hope you enjoyed listening to Meg's story. Pretty impactful. I think her years of experience as a nurse gave her an insight, and also to acknowledge, to know, hey, I don't know what I don't know. Let me do this experiment myself and see what's going on in the inside of my body, especially because she saw those numbers creeping up over time. One of the things that's most frustrating about the traditional healthcare system is you get your blood work done and your numbers are slowly creeping up every single year. And then eventually you get to a point where, oh, they're at the line, you need medication now. What if we were actually able to prevent that from happening by taking control of our health, by managing our nutrition, our sleep, our lifestyle choices, exercising regularly, prioritizing strength training so that we were taking control of our health? If you are interested in the CGM experiment, you can click the link in the show notes and learn more there. If you are interested in just working with a healthy steps nutrition coach, maybe you're just unsure where to start, you want a coach to help you create a plan that's realistic for you, most importantly, keep you accountable, you can go to hireanutritioncoach.com to find a healthy steps nutrition coach near you. And of course, if you want to connect with Meg, her Instagram and their gym information is in the link in the show notes. If you enjoyed this podcast episode, don't forget to subscribe, leave us a review, and we'll see you back here soon.